just so people can be reminded, when we say social determinants of health, we're talking about things that happen in your life that impact your health that aren't necessarily in and of itself a health condition like I broke my arm.
Right. Exactly.
So tell us a few more of those, just to remind people.
In summary, poverty itself is the biggest social determinant. But when you look at across the board, housing, job training, education, all these environmental things that, again, just like you said, if someone breaks their arm, someone has a chronic condition, they're in the hospital, we want them to heal appropriately, but we send them back out of the hospital, maybe not even a home to go to, let alone food in the pantry, let alone healthy food in the pantry. And then they often get into a vicious cycle where they may be transient, going from home to home, between jobs. So it's really all of those environmental factors that we want them to heal, but how can they if they don't have some of those supports?
And it costs a little bit of money when, people can't really heal right.
Absolutely.
And so it's in all of our interest to understand this whole idea that even if a health system does the best possible job to make you well, if the environment you're in isn't helping that system along, it costs you time, it costs you money, it costs you time off work, it costs, taxpayer money for, further treatment that you might not have needed if the environment was better. So it does affect us all, these social determinants of health.
Absolutely. And we talked about when we were first proposing the things we were going to do, it really hit me hard when you talk about the trade-offs, especially for our most vulnerable populations, our children, our older adults, that a family might have to choose a child might be diagnosed with type 1 diabetes. We know how expensive it can be to manage a condition like that. They might have to choose on any given month between paying for insulin, other medications, their consumer's bill, food, let alone healthy food. So those trade-offs and the data that's out there is absolutely kind of frightening that our patients, we send them home with all these prescriptions for medications, and they really have to make these really difficult, life-changing choices on any given month.
Toxic stress.
Yes.
We talk about the toxic stress of hunger, and that's one of them. When you can't pay all your bills and you've got to say, okay, I have a child that's diabetic and needs food and I can't provide both. That
Absolutely.
is stressful.